at SIOG this year, I presented the hematology plenary focusing on updates in hematology. Specifically, I talked about how aging is a major risk factor for the development of hematologic malignancies. And importantly, we talked about how hematopoietic stem cell aging has a lot of overlap with other aging hallmarks. And so as such, the topic of my presentation focused on new FDA drugs and indications, particularly for older adults with blood cancer. One of the studies that I featured was focused on the IMerge data, which was a randomized controlled trial looking at imetelstat for patients newly diagnosed with myelodysplastic syndromes and the benefits specifically for older adults with this debilitating condition. We talked about clonal haematopoiesis and the relevance of new calculators that can help identify patients who are at risk for transformation to myelodysplastic syndrome and acute leukemia. I talked about new risk stratifications, particularly for patients newly diagnosed with AML. For those that are receiving lower intensity therapies, we talked about how the Beat AML study was available for patients with newly diagnosed AML that are receiving lower intensity therapies to be able to better risk stratify those patient populations. We moved on and talked about for patients that are receiving allogeneic transplant. There is a new CHARM study which identifies geriatric risk factors that identify patients who are at risk for 1 year non-relapse mortality following allogeneic transplant. I moved on and talked about for patients who are newly diagnosed with multiple myeloma, particularly for those patients, they're looking at patients newly diagnosed with multiple myeloma and the IMROZ data, a phase 3 randomized controlled trial looking at patients who receive isatuximab in combination with bortezomib, lenalidomide, and dexamethasone and having a benefit over a 3-drug regimen for patients not going on to transplant. I also talked about for patients with relapse follicular lymphoma, that there is a new CAR T indication for patients who can benefit from CAR T. I also outlined many of the new models for CAR T, particularly clinics that are being developed to be able to optimize therapy for patients with CAR T, and also that the CAR T modality is well tolerated in older adults, and how we can be able to use this modality as a new option for patients with mostly relapsed disease. And that was my conclusion of all of the novel therapies and new drug indications for patients that this year, over the past year, for patients with hematologic malignancies.